So, hello everybody. Good evening to you. Thank you so much for joining us on your Wednesday evening for our Pharmacy First event with Sarina Mughal. My name is Olivia and I work in the marketing team here at Lokia Locum. So you are very welcome to join us. Apologies for being a couple of minutes late. It wouldn't be any online event without some technical difficulties, but we are all good to go now. So thank you much again for joining us tonight. So tonight we are going to have a bit of an agenda. So if you are new to one of our Lokia Locum events, I'm just going to give a quick introduction about the company itself. I'm also going to talk about Locate Learning and the Pharmacy First modules that we have available. And then I'll be passing over to Sarina, who will be giving you a recap on how the last 5 months of Pharmacy First has gone and her learnings from the experience. And then this event will mostly be a questions and answers forum. The questions that we have got in the presentation have all been submitted by pharmacists and pharmacy workers over the last couple of weeks. So please do feel free to post any other questions that you may have in the comment section on LinkedIn, and we'll be able to get to them. We've got some dedicated time towards the end of the event to get to your questions also. So please feel free to post during the event, and maybe your question will come up also during the presentation. So first things first, who are Lokia Locum? So we are an online platform and an app. So currently there is 44,000 locums across the UK that are currently working with us. And that is connecting 44,000 locums with 8,000 employers across the UK. In my next slide, you'll see some of the clients that we work with. Everything from the large multiples like Asda, Day Lewis and Boots, and straight through to independents also. So our motto is finding the right person at the right place at the right time. So internally, we have got a locum success team that whenever you sign up to Lokia Locum, you are given a dedicated locum success consultant who will be there with you every step of the way to get you in the right place at the right time. We also have an app that you can download from Google Play and the App Store. Within the app, you are able to create your account, you're able to view all the shifts available. So I do recommend that if you are not currently signed up to Lokia Locum, definitely do create an account to go and see what is available for you if you're interested in picking up some locum shifts in community pharmacy. There's definitely a wide range of shifts online that you can take a look at, and then also see some of the benefits of working with Lokia Locum in terms of our rewards program that you're able to track via the app. So here you'll see some of the clients that we do work with. As I said, we work with, the multiples like Asda, Boots, Superdrug. The reason that you'll see Specsavers is here is because we also work in the optometry market, in case you were wondering what is going on there. But we work in the two different markets. So as I've mentioned, Lokia Learning is a free online CPD platform that is available to all Lokia Locum users. So what the platform is there are thousands of pharmacy modules within the platform. Recently, we uploaded Pharmacy First CPD accredited modules that you can access. So whenever I send out the slides and the recording tomorrow of this event, you'll be able to go and create your free Locate Learning account and take a look around. There's different modules on each of the 7 ailments that are on the Pharmacy First service. There's dedicated modules that sort of just help you, give you an overview of the treatment and just sort of brush up on your skills and knowledge also. The good thing also about Locate Learning is that all of your CPD points, you're given a certificate whenever you complete the modules, and then you're able to store that all in the platform, and it makes it really easy come revalidation time that you're able then just to download your certificates and prove that you have completed all of this learning. You can also store your peer reflections and discussions and everything within the platform too. So if you would like to take a bit of a tour around it, please, I would encourage you all to create an account and to go and see what's available. There's a lot of industry news available too, from different pharmacy sources across the UK. So it's a really, really useful tool. You'll see just in the screenshot here, this is sort of what your homepage will look like. You're able to track the courses that you have started and completed. So it's really, really user-friendly. If you've got any issues like creating the account, you can reach out to us with the contact details at the end of our presentation tonight, and I'll be able to help you get set up and running. So I am going to pass over to Sarina to get into the best part of the evening, talking all about Pharmacy First. So over to you, Sarina. Thank you.
Thanks, Olivia. Hey, everyone. For those of you who don't meet, yes, my name is Sarina Mughal. I'm a pharmacist. I've been a pharmacist for about 10 years now. Done a lot of work with Locator Locum before, loads of these sort of webinars just across my career. And yes, I've got several different roles, a bit for the pharmacist entrepreneur. One of my main roles at the moment is I am the head pharmacist and pharmacy director of Harrods Pharmacy. I also have my own aesthetics clinic, House of Health and Aesthetics, and I do a lot of aesthetics dermatology work on the side, plus a million other projects within the industry. Thank you so much to everyone who's joined. Of course, it is a Wednesday evening. It is a nice evening, so we're really grateful for your time. Slightly following on from what Olivia said, this presentation will be on the Locum learning platform. It's actually a really good tool. As you know, most people's CPDs are kind of due like May, June time. I know mine is due next week. So it's actually a really handy one-stop place to just put all your learning, and then it's easy to just transfer it over to your GPHC. Right, so let's get into pharmacy first. So I appreciate some of you here would have already been doing the service for the last 6 months or so. Some of you might be returning to work. So going to do a little bit of a recap about what exactly is Pharmacy First. And the actual goal for this webinar is just to discuss how you found it, what we've learned, and just to answer some of your questions. And so a nice place where we can just share the experience. So it is a service launched at the end of January this year. It was huge. It was all over the news. I don't think pharmacy's been in the news that much in a very long time, especially community pharmacy. Essentially, it was to build on to the NHS Community Pharmacist Consultation Service. And the whole point is to basically help community pharmacies and community pharmacists provide ailments and solutions for some of the top 7 most common conditions that a GP might see. So, for example, we've got things like otitis media, earache, sore throat, impetigo, shingles, infected insect bites, sinusitis, and uncomplicated urinary tract infections. The whole point of this was to actually help, free up some of the time that GP appointments, so then at least GPs can focus on things that are a little bit more serious, that require their full attention. So the whole point is to, yes, free up GPs' time, upskill pharmacists more, and to basically help us serve the community a bit better. It is basically done by a robust set of clinical pathways. So for those of you who have been using the service already, you'd understand that we have a whole Pharmacy First IT system, and there's a gateway criteria just to triage patients properly. And obviously there is an inclusion and exclusion criteria with a specific list of prescription-only medicines that we can supply for these conditions. Olivia, can we go to the next slide? Because I don't think I can do. Thank you. Oh, back. Next, sorry. Yeah, perfect. Okay, so pharmacies are paid around £15 per consultation. And obviously there's different thresholds at the moment. So for example, it officially launched at the end of January, so the 31st to be specific. And then there was targets for every single month for each pharmacies. So as you can see in the table below, there's a minimum target. So it does increase every month. And the goal is to basically, of course, if you hit that target, the pharmacy will be paid an additional £1,000 payment. Essentially, it is, you get that extra payment to help, with like pharmacy costs, etc. And the money has to be moved somewhere. So you're taking on some extra workload from the GPs. So ideally, they are happy to pay a bit extra. Claiming is done through the MYS portal. A couple of stipulations: you can't actually claim anything after 3 months. The whole point of the Pharmacy First scheme was, yes, to move the workload from GPs to community pharmacies, but also to kind of help to upskill community pharmacists, because I personally believe we are the most skilled profession that's actually really underused and underutilized. We learn so much at university, we have so many skills, clinical skills, that unfortunately sometimes when we get to community pharmacy, we don't get to utilize them as much as we would in some of the other sectors. Now, the funding that's been put into the scheme should hopefully allow around 12 million consultations per year, ideally 3 million per quarter. And there is a note that from the 1st of April, there was actually an initial cap of 3,000 consultations per month per pharmacy as a maximum. So as we've discussed already, the clinical pathway. So we've got 7 of the most common conditions. Please take note of these actual age ranges, because I've had a few questions from different pharmacists, and in terms of competency as well, there is criteria for the scheme. And especially for ages, some criteria is from 1 year and above, and some is obviously from 18 years and above. So this is really important, actually, only because I've come across some pharmacists who aren't necessarily confident helping children, and obviously the signs and symptoms you need to look out for certain clinical conditions can be quite different for different ages of children. So just a few top tips. Just give me one moment. Yep, so just a few top tips. This is just from what I've experienced, and some of the feedback I can only share with others, and some of the things I share with some of my more junior pharmacists. The first most important thing is your training. You just need to be very confident and competent before you perform any service. I think the most daunting one at the moment that people are finding is usually the earache service, because that does involve the use of an otoscope. I would say practice devices on colleagues, make sure you go on extra training. I'm actually going on another training. You can never be overtrained, especially when you work in the medical sector. Always practice, and if you're not confident or competent to perform that service, then don't do it. That's the biggest advice I can give you. If you're not confident, don't do it. And the only way you will get confident and competent is to practice more and more. Like I said, you seek alternative training methods. So I appreciate we've got a different variety of pharmacists here. We've probably got locum pharmacists, pharmacy managers, relief pharmacists, etc. Those who might work for large chains or multiples. Even if you feel like the training that's provided to you from your employer is not of a good enough standard, or you still don't understand, just go and seek more training. Another thing I'd say is definitely document everything. So on the Pharmacy First IT systems, there is obviously an area that you have to document. Me personally, use Pharm Outcomes, and you'll have to document, your clinical findings, the discussions you've had with the patient. Please be careful what you document. Of course, documenting is a key consultation skill, and all your documents have to be accurate, but the patients can actually see these notes. So be careful that you're not writing things like the patient was extremely rude, etc., because the patient can actually see what you're writing. Make sure it's as accurate as possible and as up to date as you can. Things that may seem obvious to us, yes, the patient has an earache, is not obvious for the note. So how I always think about my note taking is, will these notes be sufficient if you are standing in a court of law and God forbid something went wrong, and the only thing to save you and your medical license is those notes in front of you? So make sure they are overly accurate. Obviously, one of the biggest, I think, challenges of Pharmacy First, not just for myself or several pharmacists across the country, I think they found, is that it's an additional amount to our usual workload. Now, for example, we've got so many things to do: the daily dispensing, running of a pharmacy, looking after patients, looking after your staff, all your other services that you're currently providing, plus this. So how I would always say to make it a bit more efficient is really empower your staff to learn the service. Unfortunately, sometimes things can always be left down to the pharmacist. The truth is, it's about being a pharmacy team. So empower your staff to actually learn the service correctly and teach them the inclusion and exclusion criteria. So it's sometimes when they are initially serving a patient on the counter, they can have certain triggers in their head to think, hold on, could this be a pharmacy first? Could I refer this to a pharmacist? Manage your staff appropriately. So if you're lucky enough to have a pharmacy technician, they could be doing a lot to help you for this service. It's all about empowering staff, teaching them, putting them on more training, and making them, what I do for my teams anyway, making them understand why we're doing this service. So as opposed to having we're doing this because we've been told to, and because we have to, and because it's in the news, get them to understand the background behind it. So for example, we know it's to help free up GP appointments. It's a way that pharmacies can actually make more money. It's a way we can actually help more patients. So it's about providing a whole holistic service. And what I find is anytime I empower my staff and explain to my staff why we're doing something, the success rate is much better. Yes, it's a new service, but I would say try to make this part of your daily services. So, for example, there's lots of services I provide in my pharmacy which are not pharmacy first. We try to incorporate everything together, and how we can make the most out of the service available. Like I said, I link it to other services that we perform in the pharmacy. We have obviously we have a microsuction earwax removal service that links in very nicely for the training. We are able to use otoscopes, etc. I appreciate not everyone will be doing services like that, but I do encourage one service that everyone should go on, especially for physical examinations and clinical skills, is earwax training, because that will teach you and how to use an otoscope essentially, and it will teach you to look at the different areas of the ear properly, what you're looking for in otitis media patients, etc. Advertising is huge. So, for example, you've got your PMEDs, you've got your OTC medication, etc. Arrange your products in more of like a clinical order if you can. So, sort of have areas that will trigger pharmacy first, depending on the actual clinical condition. Where I work, unfortunately we can't use stickers or anything like that, but I've seen really nice pharmacies where they'll have badges for staff to wear saying, ask me about pharmacy first if you have any minor ailments. There's lots of things you can do, such as stickers and shelf wobblers, etc., just to make your pharmacy a bit more attractive and to basically encourage patients to ask about the service. And also, it's not just to encourage patients, it's actually to remind staff that you're performing this service. Statistically, they say before change is made, someone has to be told something between 6 to 7 times for a change to actually be effective. So it's going to take a while. We are in the first half of the year of a new service, and whilst I appreciate some of your teams may be 100% on board, sometimes it can be quite difficult to actually get the gist of it all. Next slide, please, Olivia. Thank you. Know your list of prescription-only medications. So, for example, when you're doing the pharmacy first service, of course, there's a very strict criteria of what you can and cannot prescribe. I appreciate not everyone's an independent prescriber. I'm quite fortunate that where I'm based, we do have a private prescribing service, which could be an idea for you guys to have in your pharmacy too. So what we found is that, yes, we have the pharmacy first service. That's our first go-to. But if, for example, as a prescriber, I know that a patient would benefit more from a different medication, or if I know a patient needs a certain medication that's not part of the pharmacy first, we would, of course, use our private prescribing service. But the reason I say know your list of POMs inside out is because then you can make sure you have enough of them in stock. The worst thing to do would be to have a consultation with a patient, go through the gateway criteria, realize, yes, they are eligible for a service. Yes, you can provide phenoxymethyl penicillin, for example, and then to not have it available. So make sure you have enough of everything in stock, including your P medicines. As mentioned before, it's very important to be empowering staff, as I mentioned, but also to be empowering your patients, to take ownership of their healthcare as well. I think education is key when delivering any service. I think it's great if you have in your pharmacy like a health champion sort of area, which I'm sure you all should based on previous services, or at least a waiting area where there's enough information for you to signpost patients. So for the pharmacy first service, we try to make sure we have a lot of educational content available, including when you're supplying certain POMs, make sure you have the correct NHS information after. So, for example, for antibiotics, for respiratory infections, for urinary tract infections, it's just good for a patient to understand a bit more about their medication and their healthcare. And then essentially, it'll be easier for them to recommend the service to other people that they know within the area, or people who are just within their communities. And that will essentially help to grow your pharmacy as a business too. We did mention this earlier on, but make sure you actually know the ages for your clinical pathways. That's the reason I've put that table in the presentation, just because it's really, at least you have it there. It's easy to locate. And it can get a bit daunting sometimes, especially when you're doing pharmacy first for children. I appreciate there can be a bit of differences, knowing which clinical condition, what is the age restriction, etc. The last tip is main offer bonuses where applicable. Of course, I appreciate not everyone on this call will be a pharmacy manager or a pharmacy owner, but I understand some multiples or even some independent pharmacies are happy to pay a small fee or compensation for these services, but I also am aware that some are not. So if you are a contractor, consider possibly offering bonuses or some kind of incentive. And that will obviously be a discussion with a more higher management position. However, sometimes it can really help boost morale, especially for pharmacists, I believe, just because we're doing so much, especially in community pharmacy. We are constantly running around. I know I am all the time, and knowing that there is all this money is coming into the community pharmacy framework and the pot and being given out to several different contractors, it would be nice to understand, okay, as a business, where is that money being utilized? So the main discussion for today is essentially, hopefully I can answer some of your questions and think about what we have learnt. I know it's definitely been, this will be a great CPD. I'm pretty sure most people's CPD this year, for whether your deadline was for May or for June, like mine is in a couple of weeks, is what have we learnt? It's definitely been a bit daunting. I know for some pharmacists, especially if you're not a prescriber, I know some pharmacists have felt a lot out of their depth and they felt like they're not GPs, we're not here to diagnose, etc. But it is a way to upskill us as clinicians. And if anything, see it in a way that it can actually open the door for other career opportunities. If you ever want to be a GP practice-based pharmacist, for example, it may give you a bit of an insight into those sort of consultations and what's expected. And then you can potentially decide if you want to stick to community pharmacy or if you want to move sector, for example. Where can we improve? I think we can improve all the time, whether you're in a GP practice, community pharmacy, etc. But from a point of where can we improve with this service, it will definitely be having more group discussions, I believe, and definitely speaking to peers and colleagues to find out what their difficulties are and what tips they have and how you can actually help each other. I think my top tip would be to keep upskilling yourself, keep getting training. There's no harm having, if you had training at the beginning of the service and then you've had to have training again, or you would like training again, it's not to say you should only have training once and you should be ready, because it is something that's quite new, and it can take a lot of practice. Is the service here to stay? I think we can discuss this amongst everyone a bit later, but in my humble and professional opinion, I honestly think it is here to stay. We've had thousands of consultations across the country. I know a lot of pharmacies are taking this service really seriously and they're actually utilizing it a lot, and it's actually very beneficial for patients as well. In my pharmacy, we've actually had so much good feedback just to say how helpful it is. Obviously, we've got a private prescribing service, which, because it's private, it can be quite costly. But now that we've got Pharmacy First service, even though we have both an NHS contract where I work and we do a lot of private prescribing and private dispensing, it's been very beneficial for patients because it's not super expensive. It's a free consultation, and it's just an NHS charge if they do usually pay for their prescription. So definitely think the service is here to stay. I would say in October, the 1st of October, there are going to be some changes to the service, so keep an eye out for that. I have sent Olivia a really good resource tool Olivia, I'm sure we can upload this to the Locate a Locum learning platform. It's actually a tool that will tell you areas where you can and cannot claim. And also I'll send her a link. There's a page that I find very useful for all the clinical conditions as well. So the more resources you have, we'll always try to upload as much information. So at least it's not just a platform for your CPDs, it's a platform you can go to for resources as well.
Yes, just on that there, yes. So the recording will be uploaded to Locate Learning tomorrow. You'll also receive a copy to your email and the resource that Sarina has provided, which is brilliant. So that'll all be received then tomorrow, everyone. So thank you so much, Sarina, for providing it.
You're welcome. I think we can jump onto questions now. Yeah. Okay, how do you prioritize referrals and other jobs in the pharmacy? This is quite a difficult one, actually, because the jobs in the pharmacy just don't end. I'm pretty sure everyone will agree with me on that. In terms of priority, for example, when you log on in the morning, you'll have sometimes so many referrals. I tend to prioritize whoever's in that pharmacy at that time, of course, in an orderly queue. Of course, if I've got children, I tend to prioritize children and child referrals first. When we're talking about other jobs, so for example, dispensing, checking, etc., I tend to make sure I delegate tasks to my staff. So depending on what is the most serious condition at the time, is it the patient in front of me in over the counter where they've got a screaming child and they urgently probably need some antibiotics and need me to take a look, that's probably going to be my priority. However, if someone walks in with an allergy and a potential anaphylaxis, of course I'm going to prioritize that, which has happened. Dealt with my first anaphylaxis in Christmas, and yes, I had to use an EpiPen twice and it still wasn't enough adrenaline. So anything can happen in the world of pharmacy. But in terms of how do I prioritize, my 3 top answers would be utilize my staff and delegate tasks correctly. Always I tend to put children first, and if the patient is in front of me. So if I've got a bunch of referrals on the screen and the patient's not there, I'll tend to do those after. Have you felt extra pressure to deliver? Of course. I'd be lying if I'm not going to sit here and say, oh, pharmacy is great. No, it's all about having an open, honest discussion. The industry is always changing compared to when I first qualified. I'm going to say back in my day, I'm going to feel really show my age here. It was the days of this didn't exist. Back when I qualified as well, there was no, it, even if you're a prescriber, it was more of a case of, oh my gosh, you're a prescriber. Now it's, oh, you're not a prescriber. So for example, I've seen pharmacy change so many different ways, so many different avenues. So of course I felt extra pressure to deliver the service, especially if you work for like a large multiple or a chain pharmacy where there are targets. And obviously, as you saw on one of the slides previously, the targets are set not just by the multiples, that's just the targets that are set by the community pharmacy framework, and that's what's available. Especially when we are discussing money, and end of day pharmacy is a business as well. Yes, we are here to help patients, etc., but we have to remember it is still a business. And if you put your business hat on, you're going to want your pharmacies to be able to hit those targets so they can get that extra £1,000 payment for that pharmacy. So yes, I felt extra pressure, but I always say I'm a pharmacist before I put my business hat on. I'm always a pharmacist first and a business person second.
Brilliant. Thank you, Sarina. So question 3. So I get concerned supplying to children. Can we do this? So something we've already touched upon.
Yeah, we've already touched on it, but I'll go over it again. Yes, we can supply to children. Of course, there is different criteria for children. If you, again, you'll have the slides, and if you go back, that's why I think that's why I put all the ages and the restrictions for different clinical pathways. Of course, conditions such as shingles, that'll be just for 18 years plus only, but some of the other conditions you can to children. Some from young children, some is over 12 years old. But before you supply to children, I would say be confident and competent, because children's symptoms can display differently. So if you are not competent or confident, make sure you refer appropriately. As long as you don't ever leave the patient and say, sorry, I can't help you. Always in pharmacy, we say you must be able to refer. If you can't do anything, you must be able to give the patient some kind of information of where they can find some help, or refer them onto the most appropriate next practitioner or service.
Brilliant. Thank you. So question 4, what advice do you have for diagnosing otitis media? Sorry if I have butchered the pronunciation of that.
Otitis media is one of the 7 common conditions as part of the service. Remember, there is a lot of concern at the moment about us having to diagnose conditions, etc. Remember, your patient is not in front of you without any gateway criteria. So the one good thing is we do have on the Pharmacy First IT systems, there is a gateway criteria. So it tells you exactly yes, no, yes, no. And I suppose that is a good way to get into it. But just for extra resources, I think the NICE clinical guidelines, clinical knowledge summaries for otitis media are brilliant. They actually help to break it down quite effectively, because with otitis media, sometimes depending on how old the child is, if it's a child, they can present with different symptoms. So for example, the most common symptom in adults and older children is an earache. And we know earache is usually some sort of sign of infection, etc. We don't always advise you to take just some OTC analgesia and that's it, because it could mean something else is happening. Now, if you are fortunate enough to have the advantage of actually having your otoscope with you in pharmacy now, which I hope everyone does, and having had extra training for earache and otoscope use, then what you need to look out for is basically the tympanic membrane. If you see that it's cloudy, it's red or yellow or crusty, then that's usually a sign that it's otitis media, needs some attention. Even if you notice it a bit perforated, for example. If you don't have those devices, you can go by the flowchart and just the yes or no questions. However, sometimes it's not always the most accurate. So remember, if you're confused about accuracy, always refer on. And in younger children in particular, they may not be able to tell you they have an earache. You'll just see changes in their behavior. So they'll be rubbing their ear, for example, or tugging on it. They'll have fever, potential cough, or like runny nose, etc. There may be other symptoms associated with it. But one of my favorite resources is clinical knowledge summaries within the NICE guidelines. I'll actually send Olivia. I'll send it to you, so then you can actually add that to the platform. It will just make everyone's lives easier.
Brilliant. That'll be great. Thanks very much. So question 5, do we have to supply a POM?
POMs that's a POM, that's a prescription only medicine. So you don't actually have to. Remember, there'll be times, and this has happened to me on several occasions, where I've done a consultation with the patient, we've gone through the questions, we've gone through the eligibility criteria, and together we've actually come to like a shared care decision. Say, do you know what? You don't actually need this. Let's just pretend it's an antibiotic. You don't need this right now, and maybe come back in a few days' time if it gets worse, etc. So you don't have to supply a prescription only medication. Sometimes it will be a case of just giving the patient advice through a consultation, how to self-medicate, what products to give over the counter, and OTC medicines. Just bear in mind, you still get paid for that consultation, depending on the criteria. It is written in the resource that we're going to upload, but there are several situations where even if you see a patient, you go through everything, and you don't supply medicine, you'll still get paid the £15 and you can still make a claim for it. So don't ever feel like you have to supply something. Even if you feel like, no, in your clinical decisions, then they don't have enough symptoms to warrant antibiotic use, you don't have to give it.
Perfect. Thank you. So that's really on to the next question.
There is obviously terms and conditions. So when there is the resource, it's actually a brilliant document that will tell you nearly every single scenario if you get paid or not. So most of the time, again, depending on the pathway. So remember, on the Pharmacy First IP systems, you have 7 conditions for the clinical pathways. Then you also have the minor illness and the urgent medicine supply. So there's different criteria for all of them, but if we're just focusing on the 7 clinical conditions, because they all make up part of the NHS Community Pharmacist Consultation Service, if we're discussing just the 7 conditions, majority of the time, I'm not going to say all because that's not the case, even if you do a consultation and you don't supply, you will get paid for that consultation.
Okay, perfect. Thank you. So this is maybe from one of our locums at the platform. So as a locum, can I request compensation for services?
I would say, as someone who has been a locum pharmacist before, and I still dabble in with locum pharmacy here and there just to keep myself in the loop and keep my knowledge up to date, I would say yes. You don't ask, you don't get, right? So, for example, I can't talk on behalf of all pharmacy businesses and contractors. I can't speak on behalf of Day Lewis, Boots, Superdrug, Paydens, etc. But I know a lot of the multiples, etc., and some independents don't pay for services, but I also know a lot of locums who do ask, and I also know a lot of locums who do actually get compensated for the services they offer. So I'd always say ask.
Yeah, and just even on that there, like, so for any locums using the platform, like as Sarina said, like you can always ask, like, so whenever you do sign up and you are in connection with like your locum success consultant, they are essentially your point of contact, with all the employers that post on the platform. So as Sarina says, like you can ask and see. It will vary depending on the employer, but definitely you can see what is available to you. So our next question.
And following on from that as well, I'm pretty sure not just Locator Locum, several locum pharmacy agency platforms, etc. It's not up to them if you get paid for the services or not. Unfortunately, it's actually up to the chain or the contractor themselves.
Yes, yeah, that is correct. Thank you. So, Sarina, do you think the service will remain long term?
So we briefly actually touched on this at the end of the slides. I personally think, yes, it will remain long term. It's, in theory, it's a very valuable service. However, in practice, we just have to prove it, to be honest. Like I said, I know there's hundreds of contractors out there who are finding the value in the service. And of course, remember, pharmacy is a business. If they are making money from it and being paid and being remunerated for their efforts, then why would it not stay? I think the only time it wouldn't stay is obviously when NHS will review all services. So, for example, this is something that's very new. So there is going to be some changes. So we launched service at the end of January. 1st of April, there was already a cap and changes. 1st of October, there's going to be more changes. So it's going to be up for revision all the time. And I think the only time when it won't stay is if we don't sort of utilize the time. So obviously community pharmacy and NHS England are hoping for about 12 million consultations a year on average. I think if the numbers were a lot less, or if it wasn't helping GPs and if it wasn't actually freeing up time for appointments and reducing waiting lists, then I think they may reconsider. But I don't think it will go anywhere anytime soon. I think it's here to stay long term.
Okay, no worries. And so do pharmacies have targets? So we touched on this before, but within the service?
Yeah, they do have targets. And remember, those targets aren't actually set by the contractors themselves. So Day Lewis, Boots, Superdrug, etc., don't actually set those targets. Those targets are set by the actual NHS framework. So the slide, I think it was the second slide we did, there's actually a table I put there, so the targets for each month. Of course, the targets increase further and further. I'm sure some multiples will have higher targets because they obviously want to make sure that pharmacies are profitable and are actually taking advantage of this new service. So I can't comment on if the contractor has higher targets or not, because I know some of them do, but the minimum targets that are set are already set out at the moment. So yeah, and the whole point is, it's kind of like an incentive. If you hit that target, we give you an extra, like a £1,000 booster money. So the way I see it is, there's money in the pot that has to be given out. So utilize that to your advantage. And if you're currently a pharmacist, a community pharmacist, especially a pharmacy manager who's on this webinar, make sure you pull as much data as you can. So, do reviews. So every month, see how many you've done, how much time it took, how much income it generated more for your pharmacy. And you can utilize that too when you're thinking about performance reviews and pay rises, etc., and making your own negotiations.
Brilliant. So, Sarina, what would your advice be for dealing with impatient customers? I know that this question came from one of our locums, and they were just referring to maybe customers and patients who maybe aren't aware, like, the full setup of the initiative, if there might be any confusion, whenever they are asking for advice.
So we've had this a lot. So unfortunately, I do blame the media a little bit because what was put in the news at the end of January: go to your pharmacy for antibiotics. They can now give you antibiotics. And unfortunately, I think that was just a really wrong message and a wrong way to convey the service. So I know hundreds of patients have been going into pharmacies and saying, you have to give me antibiotics. It said so on Sky News or BBC News, etc. So unfortunately, we get the wrath of them. My advice will be is obviously make sure you are patient. So I try to sort of reason with my patients. So I sort of sit there and explain to them. So I let them finish. A lot of time they have a bad habit of jumping in. A lot of time I'll just pause and I'll say, have you finished? Because then I can explain, and that they sort of go a bit quiet. You don't need to be rude about it. You just have to be assertive and say, sir, madam, yes, we have this service. It's not as simple as we are going to give you antibiotics. We have to go through a consultation process just to make sure the medication we give you is safe. I appreciate you may think you need antibiotics, but that's not always the case. We are clinicians. We've got a lot of experience, and we have to go through a consultation process. And then I usually flip it back on them and I'll say, is that okay with you? They usually go quiet. And if ever a patient is not happy, one of the good things you can say for this service is that if you are not happy, sir, madam, etc., you're more than welcome to book an appointment and go see your GP. Soon as you say you can book an appointment and go see your GP, they know the wait time for their GP is a very long time. So they could be shouting, screaming in your pharmacy and say, oh, you're taking too long. I tend to just say, oh, you're more than welcome to not use our pharmacy and go see your GP instead. And then they tend to just wait.
You're a bit much safer going to the pharmacy then. That's the end of our questions that came in from our locums over the last couple of weeks, the pharmacists. So if anybody on the event has got any other questions that we may not have covered during the last few slides, please do feel free now to just message in the comment section. Cynthia, you have asked here just about the face-to-face training on the ear examination. Sarina, would you know any good training providers of some of the Pharmacy First initiatives?
So it varies depending on locality, of course, depending on your budget. If you're going to pay for something yourself, if it's through your employer. Just from my current experience, for me, it's a little bit different. I'm going to be completely honest. I am a prescriber, so already had experience with using an otoscope, etc. However, I've actually done extra training with Timper Health, and that was through Day Lewis Pharmacy because they offered that to us. And I personally think Timper Health is one of the best training providers. I'm sorry if there's any other training providers for ear stuff on here. I'm not being biased, but I've had such a good experience with Timper Health. It's long, so there's several online parts to it. There's also webinars and reviews, etc. And I've got another face-to-face session next week, just as like a refresher, how to do more of the practical work. But they've made it so, I don't want to say easy. They've made it easier to digest all the information because you sort of go back to anatomy, and the only way you're going to get confident is with anatomy. So I'd honestly say Timper Health is spelled Tympa Health. It's actually the training and the owner is a ENT specialist, and they've got a great team. So I would always recommend their training.
Brilliant. That's a great recommendation. Thank you. So we'll just give it on a couple of minutes just for anybody else who's got any other comments or questions maybe to add. I'm just thinking back to, we had one of these events at the end of January, just whenever Pharmacy First was launched, and there was a lot of just like apprehension within like the viewers, really just concerned about delivering the service, and it really all boiled down to the confidence, levels of actually delivering the services. So I think, Sarina, like whenever you share all that advice with us tonight, and the resources that are now available, hopefully people are feeling a bit more confident
Yeah.
in delivering the services.
And I'll admit, I was the same. I like, obviously I've got other pharmacists in my team, etc. We have different locum pharmacists all the time, and I train a lot of junior pharmacists and newly qualified. And it was the same. It was more worry across the country than more positivity, and it's understandable because sometimes we get thrown this is the joy of pharmacy. Sometimes we get thrown these things. People who are much larger than us, who are in much more positions of power, they're making all these decisions, and sometimes they're not necessarily pharmacists who are making these decisions, so they don't always understand the day-to-day running of all of our systems. But I can say, yes, February, it was a bit chaotic. What do we do? Are we confident, etc.? And then by now, everyone's a lot more comfortable with it. Again, I'm not going to say everyone has started the service in February. All the pharmacies did, but I don't mean all pharmacists have started. I mean, I've got a couple of locums that I'm still going to be training because I have new pharmacists coming in and out all the time. So I'm quite heavy on making sure everyone can do the service, but it's something that just takes practice, I guess.
Absolutely. And I loved your advice just about the continual training. So that's like the modules that we have on Locate Learning and the different resources that are available. And then obviously with the in-person providers too. This is always best to sort of we always sort of encourage our locums to upskill in many different of the pharmacy initiatives. So definitely for Pharmacy First, it's definitely important. I see Halima, we will be sharing the recording of the event afterwards, so you'll be able to see the slides that you missed at the beginning. So we'll be sending that recording out tomorrow, and then some of the resources that Sarina has kindly provided then too. So don't worry about that; you can catch up on that too.
As long as you've registered for the event, if you've missed bits or your internet connection died or something, it's lucky that you have access to it again afterwards.
Yes, yeah, absolutely. But I don't see any other new questions coming in. I think we covered a lot there this evening with the questions that everyone had sort of submitted over the last couple of weeks. Was amazing. So Sarina, just lastly, thank you so much for delivering that tonight. It was really, really helpful. I know that I know that some people probably didn't seek to join, but definitely people get caught up afterwards, and just to see the learnings. So as I say, like I'll be sending the recording out tomorrow with the slides and resources. So expect them in your inbox if you registered. But yeah, thank you so much for joining us on this Wednesday evening, everyone.
On a Wednesday evening. So we are very grateful for your time. And of course, Olivia, like you mentioned as well, if you have any questions or think of anything after, you're more than welcome to drop either of us a message. We can always try and help and answer them. But one thing I would say is definitely sign up to the learning platform. It's free to use, it's easy to use, and it's just a good one-stop place to have so many different bits of information. And
Thank you.
CPD time is around the corner, guys.
It is looming and the countdown is on.
Yeah.
So thank you so much, everyone, and have a good evening. Thank you.
Have a great evening. Take care. Bye.